Okay, so I'd like to just start by welcoming you to this historic event, because this is the first event of the IBC Network Foundation Canada. We have been working behind the scenes for, I think it's about 14 or 15 months. We got our charitable status last October, and we just really wanted to have a launch event to welcome and celebrate this occasion. So just to let you know, for those who don't know me, I'm Deb Mosnyk. I am Danielle's aunt as well, but I am also the second of the board members for the foundation. Danielle is, of course, the founder and board member, myself, and then there is Carrie, who unfortunately lives in Vancouver at the moment, so she couldn't come to join us for the event. However, she's moving back to Toronto in May, so she will be on hand for some of our upcoming events. We're very excited. So in case you didn't get the information, we do have just a little prize giveaway. At anybody who made a donation of any size, first can I say thank you if you did, and a donation of any size, you are eligible for our giveaway. For those who've been enjoying the fabulous food that we've had, yes, in our little giveaway package, there is a $50 gift certificate for the restaurant. So if you've enjoyed it, you can have some more food from here. And anybody, of course, who wants to, feel free to. Thank you, Scott. Helps to have family who knows something about technical things, doesn't it? Anybody who wants to can order some takeaway if you want to have something for your dinner later on. So the speakers that we'll have today, we are lucky that Danielle will be speaking to us, talk to you a little bit more about the foundation. We have our Chief Scientific Advisor, Dr. William Tran, who will be talking to us, and Natalie Feldberg, who is someone with IBC and a staunch advocate for us as well. We just want to briefly mention that we have all of you are special guests, of course, every single one of you. But we do have a few special guests as well that we'd like to introduce. We have our other medical advisor, Dr. Poonam Rana, the medical oncologist at Humber River Health. So we're very excited. We have Dr. Nicole Callan, a surgeon at Oakville Hospital, who's joined us. We have Dr. Sam Berger, who works with Danielle on the PFAC, have I got that right? That's committee right. At Humber River as well. Welcome. And we'd like to also welcome Jennifer Taylor Heckert, who is a board member from our sister organization in the U.S. And she came from, I think it's Wisconsin. Was it Wisconsin, did I hear? Ohio. No, Ohio. She came from Ohio with her husband to join us today, which is terrific. We have some IBC sisters who've traveled long distances. One of our speakers, Natalie, flew in from Ottawa, and we have Michelle from Alberta. So thank you so much for coming all that way for this event. And we just wanted to also note that we have some colleagues, nurses from Humber River. We have Yulia and Vondel and Christina. And Yasmin, who's a research associate, all from Humber. So thank you very much for joining us. I mentioned the speakers that we've got. If anybody does have any questions for us or for the speakers, we'll just ask that you maybe hold it and ask some questions in the mingle period afterwards, just so that we can keep the speaking part to a reasonable time. And again, we've commented on the food, but we just have to say a huge thank you to Tabuli for allowing us to have this event here. The food, the service, everything has been fantastic, and what a beautiful spot. So without further ado, I'm going to pass it over to Danielle, our founder. One thing I forgot, in case any of you missed it, I wanted to also thank Dr. Rana, because Danielle and Dr. Rana were featured on CTV television this week with a nice little segment on the launch and the founding of this charity. And so for those of you who would like to see it, we can send you a link to that excerpt. It played on the nightly news, I think on Wednesday, and then on the noon news on Thursday. So we're just thrilled with the acknowledgement and the education awareness provided by CTV and Danielle and Dr. Rana.
Thank you so much. We actually,
sorry, I should have put it there.
Somebody messaged me, we were also featured in Montreal. So I'm not sure, I didn't hear from anybody else anywhere else, but we may have gone national, I'm not sure, but it's definitely fantastic for the IBC Network Foundation Canada. Now, I am not as eloquent as Deb, but I have prepared a few notes, and I just want to reiterate what she said, and just first of all, thank you all from the bottom of my heart. I'm not gonna cry, but this means so much to me to have everybody here today and for all of your support. This has been a labor of love for all of us, and it means the world to see so many faces, both from the medical world and from our families and other IBC sisters together in one space is everything. Now, of course, most of us here today know that inflammatory breast cancer is a rare and aggressive disease. But when I was first diagnosed, I quickly realized that nobody around me had ever heard of IBC or inflammatory breast cancer, or knew anybody that had ever heard of IBC. So while I had this incredible support network of wonderful family, friends, the most amazing medical team, both at Sunnybrook, at Humber, fighting to save my life, I felt very alone still as well, because I didn't know anybody that had what I had. There were no survival stories that anybody could share with me, and I was scared. I was scared, and I was in a very dark place. And unfortunately, my story is not unique. It goes something like this. A young pregnant woman notices changes in her breast, and just to say, it doesn't have to be a pregnant woman, and it doesn't have to be a young woman, but that's my story. She notices changes in her breast, swelling and skin thickening, and she's told it's nothing. Then comes the orange peel sort of skin texture, and she recognizes that that could be a sign of cancer. And even after an ultrasound, she's reassured, nothing to worry about. Then her baby is born, and she won't nurse on the right side. Another ultrasound. Just an infection, they say. You're too young to have cancer, they say. And by the time she finally hears the words, you have cancer, it's already stage 3, and within months, it's progressed to stage 4. And that is why we are here today. My name is Danielle Cameron, and I founded the IBC Network Foundation Canada because stories like this should not be happening, and nobody facing IBC should have to face this alone or feel alone. IBC is often called the silent killer because it grows and spreads so rapidly, behaving like nothing like typical breast cancer as we know it. It doesn't have the usual telltale signs, and you often won't find it with routine screening. It hides in plain sight. No one is looking for it, and that is a problem. How do we fight a rare and aggressive cancer that nobody's looking for? That is exactly why we need to raise awareness, peel back the silence, as is the hashtag, and make inflammatory breast cancer impossible to ignore. But awareness isn't enough in and of itself. Too many patients face delays, misdiagnosis, and a fight for answers. And I have heard from countless women across Canada alone, not to mention in the US, who have sought care from their local healthcare providers, were prescribed antibiotics, and often ended up being the ones to suggest inflammatory breast cancer as the issue, only to be told that it's an infection, or they're too young, or even, unfortunately, that it doesn't exist. They had to push for further testing and fight to get the right diagnosis, and these kinds of delays cost precious time. And please let me be clear, I am not blaming these healthcare professionals. They are doing the best they can with the information that they have. I had wonderful midwives. I have an amazing GP who I fully respect. It's not their fault. But I'm sharing this to say this is why education is critical. We need to make it easier for frontline healthcare providers, including these primary care doctors, nurse practitioners, midwives, even dermatologists, to recognize these symptoms of IBC and take action immediately. Early detection and treatment can make a world of difference in patient outcomes. Now, awareness and education are only one piece of the puzzle. The other very, very important piece is research. We need research. IBC is different from other types of breast cancer. It spreads differently. It reacts to treatment differently. And yet, most of the research done on breast cancer excludes IBC. That means we're often left fighting a cancer that medicine doesn't fully understand. Right now, IBC remains one of the most aggressive and least understood types of breast cancer. There's no way to detect it early, and too often treatment comes too late. And that is, that's the problem. And the only way that we can change this is by funding IBC-specific research that doesn't just lump us in with other breast cancers, pun intended. Sorry, I know. But focuses on what makes IBC unique, research that really saves lives. And that's why this work matters, and that's why your support means everything. And well, today this is our official launch of the IBC Network Foundation Canada. We want you to know that we have actually already been hard at work laying the foundation for some of this change. Here's some of the things that we've accomplished so far. We have developed an extensive website to provide reliable, evidence-based IBC information. We attended a large conference in Boston at Dana-Farber with medical experts and had an amazing tour of their research lab where they do conduct IBC-specific research. It was inspiring. We host monthly support meetings through our Facebook group for IBC sisters to talk about anything that they need to talk about. We have run webinars with nurse practitioners to expand knowledge in the medical community, and that's just the start. We've also there's more, too much to list, but those are the real big accomplishments that we wanted to share with you. And truly, this is just the beginning, and it's very exciting. And today isn't just the launch of a charity. Today is about changing the future of inflammatory breast cancer. It's more than just an event or a launch party. It's a movement, and it means so much that you are here to celebrate. Thank you so much.